mission of the centre is to develop improved methods of restoring functioning in people that have lost it through disease, injury or ageing. And most, if not all, of what we do is geared very strongly towards developing new clinical modalities that will change the way these people are treated in the clinic. It's not purely academic, although there's obviously a key academic component, but ultimately we want to make people better. So if they can't walk, we want them to walk. If they're frail, we want to make them strong. If they have arthritis, we want to make their joints healthy, and so on and so forth. We're trying to amplify those areas of excellence where we already think we have the kernel of success, and launch new ones where we think it's the way of the future. So some good examples among many are, I've mentioned the big concentration of expertise in spinal cord injury, for instance. So that's something we definitely want to grow and develop even further. And the telemedicine aspect is one area where I think we'll devote some resources to bringing it to the fore, seeing that we have a bedrock of expertise and we have enthusiastic individuals who want to do that, and some funding to make it happen. Yeah, in the area of the musculoskeletal rehabilitation, I mentioned we're trying to get this gene therapy trial organised and hope to, within the next year, bring that into the first patients. And it would be a bit of a stretch, but it would be very nice if we'd also be using some of these stem cell approaches to regenerating tissues. I mentioned the disc, and I mentioned cartilage and bone. Some of these stem cells may also be of value in treating the disease process of osteoarthritis, and we hope to start a clinical trial there. And in fact, Jay Smith, who's the Director of Regenerative Rehabilitation, is already planning a clinical trial in that direction. So,
and some goals.
Yeah, so we have fairly ambitious goals for this emerging area of regenerative rehabilitation, and we aim to be one of the leading centres that builds on the existing strength at Mayo in regenerative medicine. So as you can imagine, somebody that's lost function through disease or injury can regain it if we could regenerate the missing part or the missing organ. And this has huge implications in a vast area, for instance, regrowing nerves for nerve regeneration. My own personal interest is I'm interested in regrowing bone, regrowing cartilage, regrowing ligaments and other musculoskeletal tissues so we can replace or enhance those after injury or disease. And this is particularly the case with war injuries. So because of the improvements in the efficiency of body armour, warriors are coming back from theatres of war with terrible wounds to the periphery because the body's been protected by Kevlar, but the arms and legs haven't. So there's massive loss of bone, massive loss of muscle, skin, you name it. And one of the things we think we can do in the not too distant future is to regenerate these missing parts and enable people to get back to normal life. It also has an application in degenerative conditions like osteoarthritis, where we might be able to regenerate missing cartilage and missing components of the joint, and at the same time control the disease so that again we can restore function to these individuals. And that's an important area where regenerative rehabilitation could be very important is in the area of degenerative disc disease in the spine, where the intervertebral disc has become deteriorated to the point where it's painful. And bad backs, for want of a better word, are a huge drain on the individual that has it and the economy that supports it. And it's one of the things we hope to do is to regenerate the disc in the spine to relieve the pain and to restore function in people that have this. Key factor that leads to loss of function in people is aging, and that affects all tissues. And one of the ones within the Rehabilitation Medicine Research Centre that has much of the attention is the aging of muscle that leads to sarcopenia and frailty. Within the centre there's research into restoring and replenishing muscle in ageing populations, and this can be done using novel drug approaches or using more physical therapy approaches such as exercise and things like this. And there's a big effort to understand how these work and how they can be brought to clinical use and restore function. Yeah, for rehabilitation, in my experience, is a very disparate field. It covers anything and everything. So I'm having to learn lots of new disciplines and how different things are done in different areas. Because I mentioned before my background was in orthopedics, where after a while you get the hang of bones and joints. But here it's bones and joints plus nerves and hearts and every organ in the body, plus therapy, physical therapy, occupational therapy, and all the rest of it. And just this general concept of wellness, which is a little bit new to me as well, that makes for a very eclectic mix that's sometimes difficult to get your arms around, but at the same time makes it interesting. Certainly not boring, that's for sure.